Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Sunday, June 14, 2026, episode 62. Today, Meta donating AI glasses to more than 130,000 blind U.S. veterans, Anthropic opening a $150 million fellowship to embed AI workers inside nonprofits, and pediatric AI now cutting child deaths by 40 to 51% across 50 hospitals in sub-Saharan Africa. We start in the United States, where Meta announced on June 12 that it will donate Ray-Ban Meta AI smart glasses to every blind veteran in the country, more than 130,000 people at no cost. The Blinded Veterans Association, Homes for Our Troops, Lighthouse Guild, and TechSoup are the distribution partners.
What makes this significant is not the device, it is the distribution architecture. The Blinded Veterans Association and TechSoup handle intake, training, and delivery through networks that already reach this population. Meta is not shipping boxes to veterans directly. The partners do the last mile.
The glasses give users voice-activated scene description, text reading, object identification, and navigation. They integrate with Be My Eyes for human-backed visual support, and hands-on training comes with every pair.
The model is the easy part. The replicable lesson is the partnership structure. A hardware company with a device platform, disability-focused nonprofits as the distribution layer, and a workforce development organization for onboarding at scale. Disability organizations in other countries can pursue the same configuration with device manufacturers.
This is the largest manufacturer device donation in Meta's history and the largest single assistive AI deployment ever targeting a disabled population. TechSoup alone reaches tens of thousands of nonprofits worldwide, which is how a single announcement becomes national coverage.
For practitioners working with visually impaired or elderly populations, the part to copy is the intake model, not the hardware. Application details for veterans are in the show notes.
Second signal, Anthropic. On June 11, Anthropic launched Claude Corps, a $150 million program to place 1,000 early career AI workers inside U.S. nonprofits across 3 cohorts. Each fellow gets an $85,000 salary, a $10,000 grant, and a 12-month placement. CodePath trains the fellows, Anthropic funds the salaries.
What makes this matter is that it targets the capacity gap directly. Nonprofits do not fall behind on AI because they lack interest. They fall behind because they cannot afford to hire AI-fluent staff. This places that staff inside the organization at no direct cost to the host.
More than 400 host organizations have already committed Code for America, RAINN, Goodwill Industries, Year Up United. The first cohort is 100 fellows starting October 2026. Applications close July 17. No degree is required for individual applicants.
For social sector leaders, the move is to apply before the July 17 deadline. Organizations that miss this cohort can register interest for January 2027. The 400 hosts committing before the first fellow even starts is the real signal here. The demand for in-house AI capacity is already there.
Moving to sub-Saharan Africa. Impala, the innovative monitoring in pediatrics in low-resource settings system, has scaled from its original Malawi pilot to more than 50 hospitals across 6 countries: Tanzania, Rwanda, Kenya, Zimbabwe, Gabon, and Malawi. More than 800 low-cost monitors are deployed, and more than 80,000 patients have been monitored or directly benefited.
The number that matters is the mortality signal. 2 participating hospitals recorded between 40 and 51% fewer child deaths over 12 months following deployment. That is a field measurement in hospitals where traditional ICU equipment does not exist at all.
A June 2026 study in PLOS One, that is the Public Library of Science journal, identifies the key enablers: embedding Impala within existing clinical protocols, targeted staff training, and a design built for high staff turnover and limited connectivity. The consortium behind it is Baylor College of Medicine and Texas Children's Hospital.
For health NGOs and ministries of health across sub-Saharan Africa, this is a replicable model with a documented roadmap. The PLOS One paper is open access and walks through protocol integration and the training plan. Contact the Impala Consortium directly to explore deployment.
From Africa to language, where Google shipped 2 things this week. Gemini 3.5 Live Translate is now live on Android and iOS. No account required, more than 70 languages, more than 2,000 bidirectional pairs, real-time speech-to-speech. Field teams can run it on phones they already carry, but it is cloud-based. Separately, Google released Eloquent, an app that runs its Gemma 4 model entirely on-device for offline speech. And Gemma 4 now runs locally on laptops too.
That contrast is the story for field teams. Live Translate is strong at the connected operations desk, but it needs a network, which is exactly what disconnected sites do not have. Eloquent today is offline dictation, not translation, but it is the clearest signal yet of the on-device track to watch for off-grid work. The practical split. Cloud Live Translate where you have signal, on-device Gemma where you do not, and do not assume Live Translate works off-grid. Verify language coverage for your specific context. Under-resourced languages vary in quality.
On the disaster watch, Ebola is the primary alert. The Bundibugyo strain, the 17th epidemic in the Democratic Republic of the Congo's history, has reached 676 confirmed cases and 136 deaths in the DRC, with 262 in isolation in Ituri province. Uganda has 19 confirmed cases and 2 deaths. 16 health workers are infected, and no approved vaccine or treatment exists for this strain. MSF, ALIMA, and the World Health Organization are active in both countries.
This is exactly where today's language and monitoring tools get tested. The Ebola response is running in Ituri and Goma, where power drops, staff rotate, and connectivity fails. A translation or monitoring tool that only works in a stable demo is useless there. For outbreak response, the field conditions are the specification.
On the calendar, MSF's Ebola simulation and training workshops begin in Nairobi tomorrow, June 15, and run through August 2026. Intensive 2-day clinical sessions at a dry facility, no live patients. Priority goes to MSF responders deploying to the DRC, with later access for the Kenya Ministry of Health and partner organizations. Contact details are in the show notes.
If you are deploying to the DRC, the value of that series is the hands-on clinical drills, not a lecture. The priority slots go to MSF responders first, so register early through the contact in the show notes rather than assuming a seat.
Funding Watch, UNHCR's Innovation Accelerator 2026 closes July 12 midnight Geneva time, with grants up to $250,000 for organizations working on protection and assistance for refugees and displaced populations. Concept-only proposals are not eligible, and Claude Corps applications for host organizations and individual fellows close July 17.
For UNHCR's accelerator, the bar is operational traction, and the brief says concept-only proposals are ineligible, so do not lead with the idea. Name the specific bottleneck you remove, the users, the data boundary, the failure mode, and who maintains the system after the grant money ends.
The through line today: AI is reaching populations that commercial markets skip: blind veterans, children in low-resource African hospitals, nonprofits without AI staff, and the deciding factor is not the model. It is the distribution architecture, the implementation roadmap, and the institutional commitment to maintain what gets built.
Every story today asks the same question: who builds the intake layer, who trains the users, and who owns the system when the deployment closes? The organizations doing this well decide those 3 things on day 1, before the launch, not after.
That's Impact Signals for Sunday, June 14, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.